And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin. Today we're going to be doing an interesting case on a lovely lady who had a lower denture made many years ago with conventional implants. The conventional implants never really worked out too well. She has one implant that's sticking up with an abutment on it. The other ones are buried in her bone, and as you can see here on the x-ray, she's had a little bit of bone loss on some of these conventional implants. These are like old style basket implants. I'm not really sure how long ago they were placed, but we're going to try to sneak a mini implant in between these two, a mini over here and two minis in the front. So we're going to try to put 3 or 4 mini implants in here and stabilize her lower denture that she really hasn't had stabilized. Even though she has the implants there, she just had a hole in the denture here to go over the one abutment. So we're going to do our best to get some O-ball implants in there with some O-ring housings. So we're going to do the 2.0 by 11 MDL implants. If you look in her mouth, you can see there's one of these implants is exposed here. We're going to try to go in between these two, put 2 in the anterior, and then another one in between the 2 on the left that are buried. These implants are so old, I really don't even know where we'd find the parts for them. So. Okay. So here we're going to start with our first one. That looks good. Contraangle driver needs to be replaced. Sorry. So here's our first one, 2011. Open bag. We're engaging good bone here. And you got the good beeping sound. That means we reached 30 Newton centimeters of torque. I'm going to now increase it to 60. And that's perfect. All right, so we got our first implant in place. And it even beeped at 60. Okay. Excellent. We're going to go ahead and do our second implant. Right in about the same spot on the opposite side. It's hard to tell exactly where those implants are. Open bag. We got good torque here. Beeping at 30, we're going to go to 60 now. Okay, so we got 2 implants in place. All right, now the tricky one, let's try to put one between these 2 on the right side here. I just want to make sure. I'm not sure we'll have enough room for the housing, but we're going to try. I don't want to go any distal because the nerve is back here. Otherwise we'll hit the nerve, so we gotta stay anterior. So we'll go right in here, in between these two if we can. Okay, got a good hole there. Let's try to place that one. Suction. Hang on. I don't know why it's going fast. Okay. All right, we got good torque there. So we got that implant in. I may have to do a little bit of a bend on that because it's a little close to that mesial implant, so I'm going to try to bend it a little bit distal. Let's see. Hold the lip out, please. All right, let me see here. Here I'm going to do about a 15-degree bend to the distal. That'll give us a little space, and we'll be able to put a housing on there. All right, very good. Let's put one on the left side. We have 3 implants in already. We're going to go ahead and try to find out where these 2 are. It looks like right here, so let's try to go a little mesial to that one. Okay, let's go with that one. Okay. Okay, we got good torque on those. This one's up a little higher, but it doesn't want to go any deeper, so let me do one thing here. Let me reverse this one. This one torqued really well, but then it kind of froze and didn't go any further. So I'm going to back it up, and I'm going to drill a little bit deeper on this one and put it back in because I want to bury it another millimeter or so. So let's go ahead and drill a little bit deeper on that one. Okay. Okay, let's try to put that one back in. Yeah. Okay, there we go. Okay, now we got them in. All right, very good. All right, let's go ahead and put the housings on these. And I'm gonna have to hollow out that denture. We don't really need any shims on here because we buried the implants pretty far down. I don't think that's gonna be a concern. But let me see here if we got room here. Oopsie, let's see. Okay. The biggest concern is this conventional implant being in our way here, but what I'm going to do is I'm going to hollow this out. I think I might use Luxitem to do the pickup here. Bite together. Bite. Okay, open. All right, we got open, bake, open. Okay, we did a big trough here. I'm going to use the Lux attempt, but I think we need to put a big shim on this conventional implant. See if we can get a large shim over it, okay? Yeah. All right, it's setting up nicely.
About a minute and a half left.
Okay, open. Open up. Open bigger. Yeah, it's still setting on the inside here. Okay. Let me take a look in here. Okay. All right. Okay, should be good. Let me just see if I can get this out. Okay, good. All right, we were able to pick up the 4 housings in the denture. Let's take out some of this excess. And I'll go in the lab and I'll just trim this and clean it up for her. Okay, we're all set. So we're going to put this in and we have you wear it for a few days and then come back and let us check you, okay?
Uh-huh.
So don't take it out over the next couple of days, okay?
Okay.
Snaps in real nice. All right, we'll get a post-op CT scan. All right, so we've successfully placed 4 mini implants in between and around her conventional implants that haven't really worked out so well. And we picked up the 4 housings and she's in good shape. We're gonna get a post-op x-ray and we'll see you next time on the Monday Morning Minute. Thanks for joining me.
Hope everyone has seen our new implant pricing. You can get our MDL implants as low as $79. And our family of Mini Dental Implant Center doctors, you can get them for $71. Take advantage of the new pricing at F.I.R.S.T, the greatest implant specials in the country. And don't forget about the International Academy of Mini Dental Implant Symposium at the beautiful Four Seasons Hotel in Orlando, Florida. And we are going to have a lineup of speakers like never before. We have a few seats left, so sign up today. Remember, 50% off. Take advantage of that great special, and we look forward to seeing everyone down in Orlando, Florida, August 1st and 2nd.